Hi, my name is Dr. Ralph Rogers. I'm a consultant in regenerative orthopedics and sports medicine, and just happen to be the CEO of Rogers Regenerative Medical Group, otherwise RRMG. People often ask me, why did you become a doctor? Or why did you want to become a doctor? And I think that's a great question because I never known anything else. I've always wanted to be a doctor. Never wanted to be a fireman. I always wanted to be a doctor. So it's a really difficult question for me because that's all I've ever wanted to do. And in fact, this is the type of medicine I've always wanted to practice. The reason why I chose sports medicine or minimally invasive sports medicine is because I've always wanted to do sports medicine. I happen to be really fortunate enough to grow up in a real sporting town. I happen to be an athlete myself. I grew up with a lot of great athletes, and I grew up with a lot of great doctors. So it was an easy choice for me. I've always wanted to do sports medicine. And sports medicine is a subspecialty of primary care. It's not surgery. For those who want to know, sports medicine is not surgery. So I've always been looking for minimally invasive treatments for musculoskeletal injuries. And that led me to regenerative orthopedics, whether it's lipogems, whether it's MFAT, which are actually the same, N-Stride, PRP, 10X. I'm always looking for minimally invasive treatments to treat my patients. What's really rewarding with my job, whether it's the 65-year-old lady with knee pain or an elite athlete or a professional athlete, is seeing people with a musculoskeletal injury that's really struggling, and then I'm able to help them to achieve their goals, whether it's a forehand, a backhand, a jump shot, or whatever, or getting them back to the game they want to play, or just physical activity. And I'm able to do that. That's extremely rewarding. I think one of the things that patients value of my practice is I'm constantly learning. I'm always out, whether it's United States, Europe. I'm always trying to get that latest treatment, the cutting edge treatment that's evidence-based, by the way. I think my patients also value the fact that you're more than just an injury. I actually sit down and talk to my patients about who they are, what they want to achieve. And sometimes my consultations will go a little bit over because it's not about the half an hour or 40 minutes. It's also about the whole picture. So I like to treat patients holistically. This is not a mantra nor a catchphrase, but I'm going to tell you a short story. You don't have to be a professional athlete to be treated like one for the last 25 years. That is mine. It's no one else's. You don't have to be a professional athlete to be treated like one. And there's a little short story to this. I remember probably about 3 years ago, my ex-wife, who actually helped me get through medical school, by the way. You hear that story? She gave me a call and said, one of my colleagues from Belgium said, hey, he's using your phrase. I had to give him a call. I said, look, next time you use that term or that catchphrase or the motto or whatever, make sure you mention my name. You don't have to be a professional athlete to be treated like one. No one else has ever said it like I do. Sometimes people ask, but I'm not a professional athlete. Can I go see Dr. Rogers? Yeah, if you have a musculoskeletal injury, you should come see me. I always have this phrase, another phrase that I use, 9 to 90. I'm happy to treat anyone with a musculoskeletal injury, whether it's ankle, knee, hip, lower back, shoulder, elbow, hands. This is what we do. We look after people with musculoskeletal injuries. So come by and see me.